As part of my job with the Health Coalition, like I talk to people all across the province, and I've heard shipbuilders say that, in Shelburne, say that they're terrified of going to work each day because if someone cuts off a finger, they're afraid they're just going to bleed out, right? And so I've heard people who work with, because the hospital's not open down there, I've heard from folks who work with immigrant communities who tell me that people were encouraged to come here, to immigrate here, and then leave because they can't get a family doctor. So I do think that in terms of the speed of it, from the top down, it might look like it's going fast enough, but for the people that actually have to live and work and die in this province, it's not moving quickly enough.
One of the most harmful political decisions, announcements that was made in recent times, in my opinion, was the commitment not to close a single emergency department across the province, no matter what. It was a commitment that was made on the basis of no evidence. And it was a commitment that was made on the expectation that it would be a safe thing to say to get kind of an equal distribution of votes. In my view, that is one of the most classic examples of pure political decisions and commitments being made at the expense of a good plan for the healthcare system. If truth be told, it's not actually the healthcare system that's broken at all. I think it's trust. And trust is a lot harder to fix.
I don't have a week where I don't hear about suicides or go home to pages of letters, okay, from elderly people begging me to be their physician. I'm just human. I'm burning out, and I once saw my energy and optimism as a renewable resource. Working in Nova Scotia is dehumanizing, and it's come at a cost of my health. But what's happening is a symptom of a system that no one person or system or government is responsible for. But we certainly all have a responsibility to start to take a more collaborative disposition and see this as a process that can be humanizing as opposed to destructive.
Physicians really want to be part of this, a partner in the changes that we see coming next, but not just physicians' voices. As I mentioned before, we need the other stakeholders, we need the university, we need to address the physician shortage issue. It's going to take a multi-pronged approach, but I think we really want to be at the table.
I have heard physician voices. I have heard other healthcare professionals' voices. As the discussion, I think, really highlighted today, many of the challenges that we're experiencing did not happen overnight. I know a lot of public discourse and conversation likes to point at the easy solution, what changed under this government, and it was the health authority restructuring, and therefore that must be the source of all of our pain and the problems being experienced in the healthcare system. And I don't think that's accurate. Fundamentally, everyone is on the same page. We're all trying to get to the same end place, which is the best healthcare system that we can provide to Nova Scotians. But we do have a lot of challenges.